Hey everybody, and welcome back to EMT training. I'm Gabby Reed, one of the Resto POs, and today we're going to be talking about patient movement. Before you move the patient, consider the following. Can the patient walk to the ambulance? If so, it's okay to have them walk. Just make sure that you take them into the hospital on the stretcher. Are you comfortable with lifting the patient? Do you need more people to help you lift them, or is the manpower on the scene enough? Do you know the proper procedures for lifting? This includes knowledge of what each patient movement device is used for and how to operate it, as well as the proper form to lift the patient. Did you bring the proper patient movement equipment with you, or is it in the bus? For example, if you are told prior to arriving on scene that the patient is at the bottom of a staircase, you should bring the stair chair with you. If the scene becomes dangerous, are you ready to evacuate the patient as soon as possible in a safe manner? So here's some pictures of patient movement devices. We've got the stretcher, the stair chair, scoop stretcher, and the long backboard. Using proper lifting techniques can help you prevent injuring the patient and yourself. It is important to lift with your legs, keep the natural curve of your spine, keep the patient close to your body, and communicate with your lifting partner. The stretcher is the primary method of patient movement. It is important that two EMTs maneuver the stretcher, one on the front side and one on the back. These two EMTs should be facing each other at all times, maintaining eye contact and communication. When loading and unloading the stretcher, you may also use two EMTs. Shown on the slide are the steps for loading and unloading the stretcher. A stair chair is used to move patients who cannot walk up and or down the stairs. It is important that the patient being moved with the stair chair is alert and can maintain their airway. Do not use the stair chair on an unconscious patient. 3 EMTs are usually involved in moving the patient. One EMT is at the head, one is at the feet, and the other is guiding the EMTs either up or down the stairs. In this picture, the EMT furthest to the left is guiding the EMT in front of her down the stairs. Notice that she has one hand on his back while the other is on the handrail. It is important to always have a guide when using the stair chair, since one of the EMTs carrying the patient will always be walking backwards. Scoop stretchers are similar to long backboards in that they are used to immobilize patients in the supine position. Unlike long backboards, however, EMTs using the scoop stretcher do not have to use the log roll to maneuver the patient onto it. The EMTs who are using the scoop stretcher may choose to slightly roll the patient to wedge the stretcher underneath, but this is not always necessary. Shown on the slide are the steps to use the scoop stretcher. The long backboard, like the scoop stretcher, can be used to immobilize the patient in the supine position. A benefit of the long backboard are the head blocks, which allow for full spinal immobilization. Because of this, the long backboard should be used to immobilize and transport the patient anytime there is suspected spinal trauma. Before using the backboard, EMTs should apply a C-collar and hold manual stabilization of the head until the head blocks have been secured to the backboard. Another important note is the position of the patient on the backboard. The patient should be centered on the backboard before securing. If the patient is not centered after the initial log roll, the EMTs should lift the patient and use vertical coordinated movements to readjust. And that concludes today's training. So if you have any questions, feel free to reach out.